If there's one thing the pandemic showed us, it's just how vital the work of dedicated employees in the healthcare industry really is. But the sector is facing a labor shortage crisis in the next decade. Organizations in every part of the industry are finding it increasingly difficult to attract and retain both clinical and non-clinical staff. So, how can HR leaders in healthcare help to turn the tide? So this is the Culture Clinic, where my co-founder, Skye, and I are constantly learning from HR experts how to build a culture where people love to work. My name is Joe. I'm a co-founder here at Guusto, and today we are joined by Kevin Kirkpatrick, the founder and vice president of search services at the Avery Professional Group. Kevin, maybe we'll kick off, and can you tell us just a little bit about yourself?
Yeah, by all means. Thanks for having me, Joe. I started Avery Professional Group about 15 years ago. It's built on experience I had working for hospitals as a recruitment leader, mostly putting together teams that are both clinical and non-clinical. So we've recently focused mostly on physician search, and we've got clients ranging from coast to coast in Canada and the US.
Awesome. Okay, well, let's jump right into the topic. So today's topic is retention in healthcare. So maybe we can start on more of a personal level. Kevin, what's the longest you've ever stayed at a company? And, thinking back to that experience, what made you stay there?
You know what? I did 9 years with a hospital. It was a mixture of employee and consultant. And it was the people. Right. And it was really the ability to build relationships with people and feel supportive and a lot of growth. Right. So I was constantly learning new things. I started off recruiting nurses. Next thing you know, I'm recruiting physicians. Then I'm recruiting executives, all within the confines of this one employer. So it was really, they invested in me both interpersonally as well as professionally.
And so looking at the healthcare industry today, why do you think it's so hard for healthcare organizations to retain employees right now?
Well, you know what, there's going to be jurisdictional things like, in Canada, it's different than in the US, but I think the core root is that we haven't made the job of the physician or the job of the nurse easier, right? And we're still holding them to archaic standards and to the expectations that they can see more patients, right? And unfortunately, because of the system, and I don't want to blame any individual person, but because the way of the system, the way it's built, is we just expect physicians and nurses to just see more people, right? So a lot of hospitals are operating at 103% occupancy. Their finances and system is built to operate at 85% occupancy. So if you build something that's, you build a car that is to go at 80 kilometers an hour, but you're constantly driving it at 103 kilometers an hour, eventually it's going to break. And I think the problem is that we have a scarcity of candidates. We're not creating more physicians. They've recently started, increasing more family medicine spots and things of that nature. But that's 6 years from now before it's going to generate any results. We've got emerge departments closing because there's not enough physicians, because the workload of a physician in the past, maybe they would have seen more patients than they're able to see now. And, physicians don't want to work 7 days a week, nor should we expect them to, right? So, I think there hasn't been a adapting of the system to meet the career expectations of the practitioners, and we just keep putting more and more work on them without giving them any relief.
Yeah, I'm personally connected to healthcare in that my mother was a nurse her entire career. My wife is actually an emergency room doctor, just transitioned into family health. And you talk a little bit about systems. And so I'm, exposed to systems in Canada, not so much in the US, but I know that some of the technical systems are very antiquated. There's still faxing documents. There isn't sort of integrated data. Do you see a big difference between the technical systems in Canada versus those in the US, or are they, struggling with similar issues?
There are a lot of similarities. The way healthcare is delivered in the U.S., there's a lot more virtual, a lot more telemedicine than in Canada. The pandemic brought telemedicine further to the forefront in Canada. So, there's delivery ways that are different, it's almost like apples and oranges to some degree. But the challenge I have is that, all these organizations create this technology that is intended to predominantly increase reporting and understanding of budgets, right? Like we're trying to track things more than we're trying to push the workflow. Things like, and I'm not a political informatics person by any stretch, but I've heard organizations that have implemented Epic and it's created more work for them than prior, right? So, there was an article, I think, in the Star that said an average family physician can do 18 hours of charting and paperwork a week that they don't get paid for, right? So, we see these notions of this technology. It often seems driven by leadership and not by the clinical, right? Like I'd like to see and hear about instances where, the Emerge doc decided to, was involved in the triage software, right? Or was involved in, the EMR in the Emerge department, right? Or was involved in the, the patient flow and bed management, right? Because they're directly affiliated with the access to beds within the hospital, right? So, I think sometimes these tech companies have the best of intentions, but the implementation has jumped over an important part of involving the clinicians on what's going to make their job easier. And I think tech as a tool, it doesn't change the workflow unless it's directly driven by the clinicians, in my mind.
Okay, so having worked so closely with healthcare and hospitals specifically for quite some time, what retention strategies have you found are most effective in healthcare companies?
So it's interesting. One of the hospitals I worked for invested a lot of time and energy in career development for their nurses. So they would send them to take critical care courses. They would send them to take OR courses. In an effort to up staff towards clinical areas that were short staffed. But they, in addition to that, each nurse had $1,000 a year they could use for courses, right? So their retention was higher because your career could be much longer and diverse within that organization because you were given the tools to maneuver the organization by acquiring new skills. So I think developing it and putting the emphasis on building the skills of your team is definitely a benefit, right? And one of the same hospital actually had like a healthcare leadership certificate put on by Schulich that staff in the hospital could take this 16-week, 10-week course to build leadership skills, right? So if that organization's investing in you, it's ideally going to provide you more opportunities within the organization you're already at, thereby by staying. And this is one thing that I don't think has gotten legs, but nurses, for instance, are leaving to go to agencies. The reason they go to an agency is they make more money. The hospitals and the government can fix that. That's not a difficult thing to do. We have a collective bargaining process that would allow us to change the wages. Secondly, they're going for flexibility, right? Like I started my company so I would have flexibility of schedule to spend time with my kids and stuff like that. So, we can only expect that nurses would want that too. So if they go to an agency, they work when they want to work, right? They're not told you have to do X number of shifts per week or X number of shifts per month, or there's going to be some punitive action, right? So if hospitals themselves created more of a flexible scheduling model, they would do so. The challenge with that is it requires more staff and puts a greater emphasis on recruiting staff. But this is anecdotal in my mind, but I would also think that more people would work frequently when they were working when they wanted to, as opposed to when they were told to by their continental shift, right? Or their 7 on, 7 off, whatever it may be, right?
Okay, so you touched on growth opportunities, flexible schedules, better compensation.
Workload, right? At the end of the day, I think the key thing too is that, organizations that manage and support the staff through workload fluctuations, right? If your bed census is down, which I don't think it ever is, but if it's down, do you give people corporate opportunities to go do something different, right? Until we find a way to support the work life of our clinicians, the way we do, the staff in every other industry, we will continue to have a hard time retaining.
And what role do you think appreciation and recognition plays in retention?
I think it plays a big role, to be honest with you, because I think you have to show appreciation, right? So appreciation is going to be, what do you provide to them, right? And maybe it's education, maybe it's time off, maybe it's Tim Hortons gift cards. I don't know what it is. It's going to differ from organization and from person to person. But I think it is finding out what visible action is going to show them that appreciation, right? And it could be different for different people. But we really need to show people that we appreciate the fact that they're, working extra hours or working long hours. And let's be honest, nobody goes to the hospital because they're in a good mood, right? Like, it's not like, oh, I'm feeling great today, let's go say hello to the nurse. No, they're dealing with us, the population at their worst when there's a problem. So if that's the type of day, is one problem after another, finding ways to recognize them that alleviates that, I think is a benefit, right?
Yeah, and I think you nailed it on the head there. Looking at clients of ours that are most successful with using recognition and appreciation to impact retention, you sort of touched on it in a bit of a roundabout way, but it's consistency and is it meaningful to that person, right? Because everyone's different, but people are not different in that they appreciate that those constant touch points of appreciation and recognition. So carrying on here, how can HR leaders in the healthcare space create cultures that are more attractive to today's employees?
Increased transparency, increased communication, sincerity, and availability, right? Like just communicate more, communicate often. The analogy that when I took a job at a hospital in 2004, I remember talking to my aunt who had been a nurse for 35 years. And I said, well, what made HR, who are the best HR people that you've ever worked with? And, what did they do? Because I was young at the time and I was so eager to be really good at this. And my aunt said, I only know one HR person. I'm like, so you worked for the same hospital for 35 years and you know one HR person. And I said, what made that person different? That person visited her area on a regular basis to say hello. Right? So being accessible, communicating transparently, being, an advocate for the staff, as opposed to policy police. I think just supporting them, being visible and, trying to build a culture that puts employees first and invests in them and I like what you said about consistency, right? Because everybody does the NRC Picker survey or, Agnew Peckham survey or whoever it is, and they run it, every few years, and they gauge their results and stuff like that. But I honestly think that if you're getting the pulse of your organization all of the time, the need for these surveys, becomes less and less, right? And I remember going unit to unit, trying to encourage people to fill out the survey because there was such an apathy towards it because, they're like, oh, they're going to survey us this, but nothing's going to change. So, polling and communicating for no reason and not showing quantifiable action is worse than doing nothing, right? So, I used to do this thing called grounding by design, where I would talk to my staff every month. I would, then to get a list of suggestions, a list of issues, and I would push that up through my leadership, and we would address those things and fix them. So then we could have a scorecard the following month that showed the things that we fixed, right? Because it was giving quantifiable changes and investments that we made in our team.
I think your comment around making HR available and sort of visible is a great point. And I think about back in my high school days, the best principal I ever had was someone who actually served pancakes to all the kids on Tuesday. He would go into the cafeteria and he'd be there serving pancakes, and he'd be asking the students questions. Hey, what's working? What's not? And he would actually be taking real-time feedback. Would be out there, not tucked away in his office, not just, this sort of high and mighty, person, but in fact was really connecting with the students and then implementing the feedback in real time. And so your comment made me think of that.
Yeah, two things. Like, the same thing. Like my daughter's principal years ago would stand at the front gate every morning at parent pickup or parent drop off and say hello to every kid, knew all their names, said hello to the parents. Parents would stop and talk to him. So he was managing the community's expectations before they ever became an issue, because he had a pulse. He knew what the pulse was, right? And one of the things I did when my first job managing recruiters is I said, you have a meeting every month with your client groups, right? So you have 7 managers. Every month I want you to meet with those 7 managers, but do not make them come to your office. Go to their office, because their office is on the unit, right? Go there, meet people, talk to people, and be visible. Because then I know that the nurses are going to see you're there. Because when you're short-staffed, you want to know what people are doing to fix that problem, right? So if you're there, you can answer questions. You can say, yeah, we went to this job fair last year. We're investing in this incentive program, or, we've hired this number of people. Managing expectations of people so that they don't feel like they're in it alone is going to go a long way to retention as well, right?
For sure. And that accessibility ties back to the things that you also mentioned around communication and transparency. So I love that. So a lot of current healthcare retention challenges have been linked to post-pandemic burnout. What do you think organizations in the healthcare sector can do to improve employee well-being?
So, it's interesting, because I've been working in healthcare for about 15, 16 years now. So for a long time prior to the pandemic, right? And, the pandemic is an exacerbator. It is not the creator of the problem, right? Like we had a problem before this, and, the system has to start building capacity for actual need, not perceived budgeted need, right? So we really need to identify what the needs of the population is going to be and start building a system for that, as well as prorating that over the next 5 years, right? Or 10 years, because, the only way to fix things are to add more staff and make the work easier, right? So, but to make the work easier, we need more people doing the work. So we need to increase team-based care. We need to increase the residency spots. Why do we have people going to med school in the Caribbean or in the US? Why can't they go to med school in Canada? Why are we seeing nurses drop out of the profession, right? So a lot of it is until we fix that experience. So the pandemic has moved us from 90% usage to 103% usage. So it's exacerbated a problem and brought something to light because of the public nature of the pandemic. And we need to really start looking at supply and demand, maximizing that. We've got some new medical schools coming, so that's good. We need to do the same thing for nurses and allied health staff and stuff like that, right? Like, we need to train enough people that there are more people that are, having to fight for a job as opposed to, anybody getting a job that graduates, right? And then looking at the ways that we can like get down and dirty in a clinician's day, figure out how we can make their work more, more palatable, right? Being a nurse is hard. It's always going to be hard, but can we take away something and, use a technology or use somebody else that can do that work? Like it's looking at the right person doing the right work at the right time, as opposed to, hoping a nurse is going to do all this work, right? Like, maybe we need more PSWs, or maybe we need physician assistants like the US, or, and truthfully, I think we need more nurse practitioners, right? So, you can only rely on more so much. So we have to look at how do we get more practitioners or clinicians, but also how do we make their lives better? So the organizations that are employee driven and employee first will outperform the organizations that solely look at the needs of the organization and then try and push that on their employees.
I love that. And, being so close to healthcare, reading the tea leaves, do you feel like we're heading in the direction of solving many of the challenges that we're facing here in healthcare?
No, unfortunately. And I'll have to admit, I'm being, a lot of that comes from being in Ontario right now and seeing the emerge shortages, right? And the emerge closures and stuff that's happening. I'm really, I'm really worried about the sustainability of the system unless we make drastic changes. And unless those changes are driven by the care providers and not by politicians, right? Because, I'm not anti-politician by any stretch, but when someone in Queen's Park determines what the budget's going to be, and in February we can't do any more orthopedic surgeries because we've run out of budget. I mean, this happened down in the London area, right? They ran out of budget, so they had to go 2 months until the next fiscal year before they could do any more orthopedic arthroplasties, right? So, until we focus on, the care providers and stuff like that, like I'm really worried. Next week I'm interviewing an emerge doc who basically has been going from emerge to emerge to keep emerges from closing. And he's often the solo emerge doc in these rural emergency departments. And rural health is getting worse and worse. There's no access to primary care because not as many physicians want to go work in a rural area than would rather work in a suburban area. And we're not incentivizing them to do so. So I kind of feel like Henny Penny or Chicken Little, they're saying the sky is falling, but I don't feel like we've done enough to start righting the ship. So I think it might actually get worse before it fully gets better.
It's a frightening prospect, Kevin.
It doesn't make me feel great, and it gives me some good encouragement to exercise a bit more, so I don't have to see a doctor. But it's worrisome, right? And I read an article yesterday in the Globe, I think it was, that 16 emerges in Manitoba were closed on the long weekend. Can you imagine being somebody in that you're building your deck in one of those communities and you put a nail through your hand? Well, you're going to have to drive an hour, 2 hours to another emerge because your local emerge is closed. And that's just a minor example. What about the heart attacks, right? Like it's, until we really hold people accountable to build a system that serves the needs of the community, we're going to be at a tough spot.
Well, this has been a wonderfully informative conversation. Anything else you'd like to add, Kevin?
You know what? I honestly think that as a community, we just need to continue to support those that provide our healthcare, right? And support them and try and ensure that people are held accountable and that our politicians are held accountable to to give them and give the clinicians the necessary tools to do what they want to do, right? Nobody wants to have to close an emergency department or, not staff it, because of, they want to take the weekend off. That's not the type of people they are. They're doing the best they can. And I think we need to hold leadership federally and provincially to task to build a system that, serves the population.
It's great advice. So with that, thank you so much for joining the Culture Clinic. Appreciate the time and thoughts, Kevin.
Awesome, Joe. Thanks. It was my pleasure.
Recognition can be a great way to improve healthcare culture and retain more staff. But implementing a program in the sector has its challenges. Check out Employee Recognition for Healthcare, the complete guide to learn how to do it effectively. Click the link in the description to get your copy. Thanks for watching. If you enjoyed the show, please hit that like button and be sure to subscribe so you don't miss an episode. And don't forget to recognize someone for a job well done today. Mucho gusto.